Good afternoon, and thanks for joining us again today. State Health Officer Alexia Harris is here. But before I begin, I wanted to acknowledge the efforts of firefighters and first responders around the state. We had, over the last couple of days, a tremendous effort to save the town of Hannah from the 316 wildfire problems that we had over the weekend. There were also aggressive responses to fires in Casper Mountain, in the Garden Creek fire, in Teton County, south of Jackson. There was a bit of a flare-up in Yellowstone Park as well. And I just want to thank the men and women who responded and did their best and actually saved the communities and did just a fantastic job. I also want to point out that we have a guard crew heading out to California to fight the fires there. And I know people of Wyoming will join me in wishing them a safe journey and safe work as they work there, saving more lives and more country. Today I want to provide a COVID-19 update and also speak about the next round of CARES Act funding. As of today, there have been 3,520 lab-confirmed cases, with an additional 631 probable cases. There are currently 3,457 total recoveries, leaving us about 632 active cases. We continue to see this number bounce around at 600 or so, so that's a plateau, but it's still a little bit higher than we would like to see. Yesterday we had 58 new lab-confirmed cases reported and a two-day total that included Labor Day, so perhaps a bit of a jump up in the number of cases today. There were 37 new lab-confirmed cases today, and our official count is at 42 deaths. For those of you who are appreciative of the fact that we are now reporting some cases of mortalities that have occurred outside the state, mostly outside of the state. If you look and delve down into our website on the Wyoming Health website, you will see that we have a breakdown of what's happened in-state versus out, but 42 Wyoming residents have passed, sadly so. Our statewide COVID-19 dashboard has been updated with the percent of tests with positive result now listed as improved. This is encouraging news. It's trended down since early August, and over the past 14 days, our positivity rate is 1.6%. This doesn't paint a complete picture of the presence of the virus in the state, and I'll let Dr. Harris in her remarks speak a little bit more about testing in this moment. It is encouraging, though, and I yesterday had the opportunity in Casper to address the Rotary Club there and to express my gratitude for the people of Wyoming for being diligent and doing the best job they can. It's resulted in our state really being much better than many of our peers in a number of metrics, most notably in our mortality rates and our infection rates. The categories of new cases and new hospitalizations continue to be listed as concerning, however. We have 12 COVID-19 hospitalizations reported by our hospitals today, a number that has ranged from 15 to 20 over the week, and if you look at that trend, you'll see that we're still higher than we were in May, and we've kind of trended up over a little bit, but hopefully we'll start to see those numbers come down. The number of lab-confirmed new cases we are seeing per day continues to fluctuate slightly. After increasing a bit in mid-August, the number of new cases has decreased over the past 14 days from 35 new cases per day to 25, and this is good news. Our current health orders expire on September 15th, and while we have not yet finalized our new orders, we are looking at changes to guidance for indoor contact sports in an effort to better accommodate athletic competitions in our schools. This weekend, I was up in my hometown of Buffalo, and I was excited to hear that some of our sports teams were playing, and they had some good luck. But it was nice to see folks out and sort of feeling good about what Wyoming is doing generally, allowing us to continue to play games. I do want to talk about a couple of reasons why we aren't making drastic changes to our health orders yet. The first is that for many Wyoming school districts, we have only entered the second week of the school year. And as I mentioned, up in Johnson County, that second week has gone pretty well. We know that there continues to be some uncertainty, however, over how effective our efforts will be in limiting the spread of the virus in school buildings until we have a clearer picture of the impacts of in-person learning on virus spread. We want to be cautious, I guess, in our approach in the fact that we want to make sure that our kids continue to have in-person learning, and so we want to make sure we ease into this in a very methodical way. By taking steps to reduce community transmission, it's more likely that our schools will stay open, that our kids will continue to go to school, that our kids will continue to compete in athletic contests and continue to be able to do the great job that our teacher, or continue to do learn from the great teachers that we have around the state. We want to have students be able to continue attending school in person, and that means using all of our best efforts to limit outbreaks and minimize exposure. The second item I want to cover is the Labor Day holiday in Wyoming. Like nearly every state, we saw spikes in the number of cases after Memorial Day and on the 4th of July. But I'm very hopeful that we won't see similar spikes 2 weeks from now with this weekend. I do want to make a comment. I spoke to Superintendent Shawley of Yellowstone Park the other day. They've had about 2.4 million visitors, and they've had very few in the neighborhood of 5 or 6 cases of coronavirus there during the summer. So we're very hopeful that people continue to practice the good hygiene, staying socially distanced, wearing coverings when they can't stay socially distanced. And as I've said before, we're careful about easing our restrictions simply because we have trended all the way in our efforts to release and reduce the number of restrictions that we've had, that we don't have to go backwards. Going backwards and losing that high ground, that would just be devastating to our businesses, to our schools, and to our citizens. So we do want to see the impact of a recent holiday and school reopenings before we take our next steps. At this time, I'd like to invite Dr. Harris up to speak about testing, contact tracing, and some things happening in Wyoming's long-term healthcare facilities. Dr. Harris.
Thank you, Governor. I'd like to start with schools now that most are open for in-person classes. As expected, we have seen cases among both students and staff. We've had examples where a case was identified in a school, and because they were able to follow the physical distancing measures, or because a parent kept their student home when sick, no other individuals were exposed or had to be quarantined. No schools have yet had to close because of COVID-19. This is an indicator of all of the efforts that school administrators, school staff, parents, and students are putting into ensuring safety while providing in-person education, which is so important for many children. We will continue to identify cases in schools, but continuing to follow our recommendations throughout our communities gives our students the best chance to be successful. It's important to remember that children can be exposed outside of school as well. We're seeing cases also result from preventable situations. We all know that University of Wyoming needed to pause their plan for classes because social gatherings were taking place without distancing, mask use, or staying home when sick. We've seen workplaces impacted and forced to close temporarily because employees worked while ill. We've seen well-planned, large events with recommended precautions to prevent spread happen successfully. but then informal gatherings of participants that happened after the large events without precautions led to spread. I'd like to move on to a brief testing update. The Wyoming Public Health Laboratory can process hundreds of samples a day or more with consistent, quick turnaround times. The lab staff has worked hard and provided creative solutions to several challenges. For example, when it became clear that providers across the state were having trouble getting sample collection supplies, staff at our lab found a way to help. One thing that's needed is called viral transport media. It's a liquid that holds the sample until it can be tested. Instead of ordering it from other suppliers when it was difficult to find, our lab produces gallons of this liquid. We package it in tubes and with swabs into kits. To date, we've sent nearly 150,000 sample collection kits across the state at no cost to those receiving them. Recently, we added the ability to test for both flu and COVID-19 at the same time from the same sample. But unfortunately, due to a sudden unexpected material shortage, we did return to straight COVID testing yesterday. We hope to again offer that combination test when the supplies become available. When a person is found to be positive for the virus through testing, we follow up to ask about others who may have been exposed. That, of course, is contact tracing. Contact tracing helps protect people by letting them know that they have been exposed to COVID-19 and that they should monitor themselves for signs and symptoms. It can help people who may have been exposed know to get tested. If a contact tracer calls, it is critical that you talk to them and answer their questions. It helps all of us. In Wyoming, we have been actively following up with each COVID-19 case, and I believe contact tracing has helped protect our communities. Finally, I'd like to give an update on nursing homes and assisted living facilities. Compared to most states, Wyoming facilities have been successful in their efforts to prevent transmission of COVID-19. I credit the facility administrators and staff whose dedication to protecting their residents has been incredible. We know the restrictions, though, especially on visitation, have been very difficult for residents and their families. Outdoor visitation has been permitted since June, and compassionate care visits have been allowed all along. With colder weather this week and promising to return, we know that expanded visitation options are needed and are working to offer safe potential options. Finally, I know people are tired of this pandemic and the precautions it's made necessary. I feel that way too, honestly. But the more careful we are, the sooner we can get to a point where we don't need any restrictions or public health orders, which I am looking forward to along with everybody else. Thank you, Governor.
Thank you, Dr. Harris, and thank you and your team for the contact tracing and the great work that you've done there. Let me just take a moment to comment on two apps that you can find at either the Google Store or the Apple Store that South Dakota, North Dakota, and Wyoming have all piloted. They are called Care 19. There's one that's Diary that gives sort of a sense of where you've been over the last 14 days. That is all actually anonymous data. It is owned by you, and you can delete it at any time, but it's very helpful if you're trying to look back 2 weeks at where you've been to know where that is. And the other one's Care 19 Alert. Both of these platforms are free. They apply to people in Wyoming, South Dakota, and North Dakota. They were developed up in North Dakota, and Governor Snow and Burgum and I have all worked on them. Again, absolutely anonymous data. It's owned by you, can be deleted at any time, but can be useful in the event that you find that you've been exposed, and also useful in the fact that it can alert you if someone else that you've been in proximity with has been exposed. So useful apps, and I encourage you to take a look at them. Again, voluntary completely, and the data is absolutely anonymous. As most of you may know, the university announced a pause of its phased fall plan last week after seeing numerous students test positive for COVID-19 in a single day. There are currently around 70 active cases, with 53 of those off campus and 14 on campus. This information isn't that much different from what's happening elsewhere around the country. I think college students are happy to be back in school and maybe a little bit more careless than they should be. And so we are seeing that several schools are having to actually pause or go backwards. And this is not different from Wyoming. I do want to say that Dr. Seidel has been very active in trying to work on how best to bring this university back on. He will be announcing a decision later today on whether to proceed with a phased return plan. But I do want to say, and I actually, as a little segue, a little bit of a different thing, also want to really compliment Dr. Seidel and Tom Berman, athletic director. Over the past several weeks, we've been reaching out to the various conferences to see if there's any way that we could play any of the sports. This weekend when I was up in Buffalo, I met a young lady who's running cross country for the University of Wyoming. I say running because that's the team she's on, but they, of course, aren't doing anything. And Dr. Seidel actually took our pleas to the Mountain West and really tried to impress the importance this is of athletic competition. When you look at Coach Bowles' experience all the way through June, July, and August without any examples of COVID in his football team, the discipline that those athletes brought, what an example for students everywhere, the ability that we can be in college and we can do the right thing, and you know, this is one of the things that we're really trying to promote. I'll continue to work. I've been in touch with Gary Herbert of Utah, governor of Utah, to see if there's ways that we can make things happen there. I think I've mentioned before that Governor Ricketts and I have spoken as well about, you know, Nebraska, Wyoming, some of the others. But I have to say that the conferences have been very, very reluctant, maybe with good reason, but the conferences have been really reluctant to let our athletes play. And when you look at Craig Bowl and his experience and the fact that all of his athletes were cleaned through several months, you know, it's unfortunate. But Dr. Seidel will be announcing plans later today, and I'm really hopeful that Wyoming can continue to be able to provide in-person learning. Yesterday up in Casper, I heard from a couple of folks about their daughter and how frustrating it is that they aren't having in-person learning. So I think students can be very helpful in making sure we return to in-person classes. One other item I want to mention is our surveillance testing program for school districts. And at this time, we have a total of 23 school districts confirmed that will be participating in the program. 15 of those school districts are opting to utilize the testing platform we now have available, and that testing could begin as early as next week. Another 8 school districts are waiting for an additional testing platform to become available before beginning this testing program. We are very hopeful that this testing program will help give us early warnings and prevent us from having to close down schools entirely because of an outbreak. So we really want to be on top of that. It's exciting that those testing protocols are in place. I want to provide now an update on our CARES Act spending. To date, we have allocated more than $829 million of the $1.25 billion we received from the federal government. You can find this information on our website, wyomingsense.gov. That'll give you a sense of where the allocations are. wyopen.gov will give you where that money has been spent. That's the auditor's great website on where checks have been going out. On September 15th, I will have the flexibility granted by the legislature to expend any of the remaining funds. You may remember that there were 3, I hate to call them tranches, but that's what they were, 3 tranches of funding, and the last comes due on the 15th. That'll allow us to adjust and redistribute any unused CARES Act funds. Our plan is to ensure that all of these funds are expended by the federal deadline on December 30th. Over the last month, we worked on an allocation plan for local governments and for medical facilities. We've also talked about an ag relief program. We're currently working with the Business Council and the Department of Ag to launch that next week with a couple of other aspects to this, one being we'll be accepting applications on the 15th for our meat processing grant expansion program, which was announced this week. Anybody who's tried to find processing this year knows that we're backed up. Sometimes kill dates are on into March, April, and May. We've also worked very extensively with broadband providers and started expanding broadband access through Connect Wyoming initiative. And I'm pleased to report that some of the most rural parts of Wyoming will now have connectivity when these projects are completed. And I really want to thank our internet providers in the state to come together to really try to work out a good program that makes good use of these CARES Act dollars. Some of the areas that will be included in this are the Smiths Fork, Yoder, Bondurant, Cora, and many other places that lacked broadband access prior to this. Our two business relief programs are still open, but funding, I have to say, is beginning to run low. I encourage all Wyoming businesses that have been adversely impacted by COVID-19 to visit the Wyoming Business Council's website and apply while funds are still available. I do want to stress that these funds are for small businesses, and we try to be as accommodating of small business as we possibly can. We want to make sure that the people of Wyoming and the businesses of Wyoming have every opportunity to actually relieve some of the burdens that have been placed on them by COVID-19 and other actions along those lines. I do want to also say that it was really heartening the other day to talk to a young business owner here in Cheyenne who explained to me that of all the states he has friends in, when he's described how Wyoming has approached small business, it seems like Wyoming really has it down and organized, and so I'm very happy to encourage you to look as quickly as possible to the Business Council for any additional relief. In closing, I want to compliment the many businesses throughout the state that are doing a great job in protecting their customers. I also want to thank the people of Wyoming who are acting responsibly as we move into this fall. Over the last couple of days, we've seen snow return to Wyoming, and it's not quite so much fun being out in the evening. We hope that we have a bit of an Indian summer. But now, as Dr. Harris pointed out to you, we're all kind of tired of this, but at the same time, our care and diligence at this time really can make a difference as we go forward. And you'll note that our positivity case rate has gone down, so the work you're doing is being rewarded. It is my hope that if we continue to make incremental progress, that we can continue to relax the remaining very minimal orders that we have in place. And so with that, I thank you for attending today, and I'm happy to take some questions. And I'll be repeating the questions that are here in the room because our mic isn't working here, but if you want to call in on the phone, please feel free. And I have a question from Will. So.
Hey, Governor, I actually have a question for Dr. Harris.
Sure. I'm always happy to.
Hey, Dr. Harris. So we've been hearing a lot about kind of the masks in school policies, and kind of is that kind of one of your guys' main focuses? I know we've only been in school for 9 days now, but is that something you guys are kind of actively kind of keeping an eye on? Can you talk to me kind of along those lines of masks in schools?
Sure. Thank you for that question. So the question was, asking about masks in schools and how does that fit into our recommendations, and are we keeping an eye on them? So yes, masks are now required in schools in the orders for both staff and students. But it's important to remember that our primary recommendation and the best way to prevent transmission of COVID-19 is to keep that 6-foot distancing. So masks are only required when that 6-foot distancing can't be maintained, because we know that distancing is the best way to prevent transmission. The evidence is really growing about the effectiveness of masks and how they can prevent transmission. And we know that there are people who don't have any symptoms, and so measures like keeping kids home when sick are very important, but they're not going to prevent 100% of cases being entered into schools. So right now we really think that those face masks, when the distancing can't be maintained, is the best way that we're going to keep kids and staff from getting sick, be able to keep schools open as long as possible. But yes, as with everything, we review the new evidence as it comes out. This is a new virus. We learn more about it every day. We reevaluate our policies on a regular basis, and if certainly when there's any indication that we can handle schools safely without face masks, and we learn more as schools goes on, believe me, I'm very happy to remove that restriction. But the evidence now really suggests that they're going to be important moving forward.
And Will, I just make one quick comment. I was home this weekend and talking to some young kids and asking them if they thought the masks were problematic or difficult for them, and they didn't think it was. In fact, they said, I can now make faces at other people and I don't have to worry about them seeing it. So. Right. Thanks. On the phone? No question?
Hello, Governor Logan.
Yes,
It's
I
Barbara Ann
can't.
from the Dix-Gorge County newspapers.
Yes, hi Barbara Ann, how are you?
I'm well, sir. Thank you so much for the funding to help our broadband up here. We do have a lot of rural areas, so we want to tell you how much we appreciate it. I do actually have a question for Dr. Harris.
All the better for me, thank you.
Hello.
Hi, Dr. Harris. I noticed that some of the county health offices are no longer doing press releases that are showing if it's a male or female, adult or child. I'm wondering if you know why that is, and secondly, even though your staff is doing so much already, is that possible then to have that on the Wyoming Department of Health website each day as a new case or cases come available?
Yeah, thank you for that question, Barbara Ann. I'm not aware of any reasons why specific counties would not be releasing the same information that they would before. I'm sure there's many reasons for that. There's always a balance when releasing information between people's privacy as well as providing information that's needed to inform the public about what's happening. The information that we post on our website, we don't usually post information about individual cases, but you can find aggregate, de-identified information related to age groups, sex, underlying health conditions, hospitalizations on our website. And from an epidemiological standpoint, that really aggregated data looking at a statewide level is what's most meaningful for us as we interpret the data, and hopefully helpful for the public as well.
Thank you.
Thanks. Other questions? Well, with that, thank you very much. Again, thanks for the people that valiantly fought the wildfires. Hannah was an amazing save, and I really thank the people there. Obviously, Gardner Creek, Jackson, Yellowstone, and please keep in your thoughts and prayers our crews as they head to California to fight the really awful fires that are out there. God bless, and thank you very much for all you're doing for our state. It is an honor to serve you, and I look forward to the days when we return to a more sense of a normal. But thanks very much, and all the best.